Hi, my name is Kristin Dickinson, and I'm an assistant professor at the University of Nebraska Medical Center College of Nursing. And today I'm going to talk with you about my journey through nursing. I first became interested in nursing as a high school student, where I developed a love of science and math. I also enjoyed interacting with and learning about new people. I thought that a career in nursing would allow me the opportunity to use both my academic and personal skill set. After graduation from high school, I started my nursing journey at Virginia Commonwealth University School of Nursing in Richmond, Virginia. Like most undergraduate students, I was not sure what I wanted to do in nursing. I thought that I wanted to be a critical care or emergency room nurse. However, my clinical rotation soon proved that those areas were not the best nursing fit for me. I also thought that I wanted to go to grad school, but wasn't sure if I wanted to become a nurse practitioner or teach. The possibilities seemed endless. Nursing is a wonderful career path as there are so many different directions and paths that one can take. However, sometimes that can seem a bit overwhelming as you try to figure out which path is the best for you. This is where the guidance of a good mentor can be invaluable. I had several mentors during my time as an undergraduate student. These mentors were very important as they listened and provided advice and guidance as I was trying to figure out my nursing path. During my junior year of undergrad, one of my nursing instructors approached me and asked if I was interested in nursing research. I honestly had not heard much about nursing research outside of my evidence-based practice coursework. She advised that I work as an undergraduate research assistant in our nursing research center to learn more about nursing research and see if it was a good fit for me. So, during my senior undergrad year, I worked as a research assistant. That experience taught me a lot about what nursing research was. I learned that through nursing research, we could answer clinical questions, generate new knowledge, and improve the lives of our patients. I got bit by the proverbial research bug. I had found my passion in nursing, and it was in research. Upon graduation from my undergraduate program, I started working as an inpatient oncology nurse. I absolutely loved this clinical experience. It was a privilege to care for patients and their families as they were undergoing treatment for their cancer. I learned a lot about nursing from this experience. Importantly, this clinical experience shaped my research interests. As a clinical nurse, I found myself asking a lot of questions. Why did some of my patients experience symptoms from their cancer treatments and others did not? What caused these symptoms, and what was the best way to manage these symptoms? These questions cemented my passion for understanding symptoms in adults with cancer and thus became the focus of my PhD and postdoctoral work. As a doctoral student, I was fortunate to have several experiences that shaped my nursing research journey. I had the opportunity as a PhD student to work as a research assistant with an exceptional oncology nurse scientist, Dr. Deborah Lyon. Dr. Lyon had 2 funded studies that explored symptom biology and symptom management in women with breast cancer. Through this experience, I learned a lot about how to design research studies, how to best collect data, and how to manage that data, and many other aspects of research. I also received a tremendous amount of mentorship in oncology nursing science that guided and shaped the development of my own research questions and studies in cancer symptoms. During my time as a PhD student, I also had the opportunity to apply for and was accepted into the Graduate Partnership Program at the National Institute of Nursing Research at the National Institutes of Health. Through this opportunity, I went to the NIH to complete my dissertation research. There, I worked with an outstanding nurse scientist, Dr. Leo Saligan. Dr. Saligan's program of research focused on understanding the biology and management of cancer-related fatigue in men with prostate cancer. Through the GPP program, I was able to gain experience working in a basic science lab. This was a new experience for me as I had not worked in a lab before, and I got to learn about how lab work could complement my clinical work. This new knowledge complemented my clinical knowledge and began my translational program of research focused on understanding biological mechanisms of cancer-related fatigue. In essence, I wanted to know what changes in the body occurred that could result in the presence of certain symptoms such as cancer-related fatigue. This opportunity provided me the experience of taking observations from my bedside practice and seeing what in the laboratory could influence or shape what I was observing in the bedside. This is what the foundation of translational science, which also is often described as bench to bedside research. I think nursing also takes a unique spin on it, and we could also take bench back to bedside. So we not only go from one to the other, I think nursing provides a unique experience to do the reverse. My dissertation research examined specifically the potential contribution of mitochondria to fatigue in men with prostate cancer who were receiving radiation therapy. This line of research was driven by patient descriptions of their fatigue experience. They often described their fatigue as a lack of energy or feelings of weakness. Mitochondria act as the powerhouse of the cell. So I hypothesized that maybe there was something going on or dysfunctional with this powerhouse of the cell that was resulting in these feelings of lack of energy or weakness. And that the dysfunction in mitochondria might be causing the fatigue. After completion of my dissertation research, I was accepted into a postdoc position with Dr. Saligan and remained at the NIH. I continued to learn and develop my program of research focused on understanding what different biologic markers might contribute to cancer-related fatigue. During this time, I was fortunate to be funded through a K99 R00 grant award, which provides 2 years of postdoctoral funding and 3 years of new faculty funding. After completion of my postdoc, I accepted a faculty position at the University of Nebraska Medical Center College of Nursing, where I am currently an assistant professor. My program of research is guided by the National Institutes of Health Symptom Science Model. This model depicts a sequence for conducting symptom science research. We begin with an observation of a complex symptom that impacts the lives of patients. For my program of research, that symptom is cancer-related fatigue. I chose this symptom because it is one of the most common and distressing symptoms reported by persons with cancer. This step is then followed by phenotypic characterization of the symptom. In other words, how do you define and measure the symptom of interest? I define cancer-related fatigue through the use of a self-report questionnaire. This questionnaire asks patients to report their level of fatigue. I am then able, based upon their self-report scores, to group patients into either experiencing or not experiencing cancer-related fatigue. In the next step, biomarker discovery, we focus on understanding what happens in the body that causes a symptom to occur. I have focused a lot on metabolic mechanisms, such as oxidative stress and mitochondrial function. Most often, these biomarkers are chosen based upon a clinical observation or experience. For example, I chose mitochondria because of my patients describing their fatigue as consisting of a lack of energy or feelings of weakness. I chose oxidative stress markers because radiation therapy is a common treatment for prostate cancer, and radiation treatment can alter oxidative stress markers in the body. In the next and last step, hopefully our research observations and findings will lead to clinical application. For example, the development of a point of care test or a therapeutic intervention such as a drug. And the goal of this is to manage or lessen the impact of a symptom and improve quality of life. As nurse scientists, our goal is to generate new knowledge, and hopefully that knowledge is used to drive patient care or management. As you can see, though, the model occurs in a circular fashion where we are constantly moving between the steps as we generate new knowledge that can influence the next direction we take. So even though our goal is clinical application at the end, the arrow continues back up to complex symptoms, because as we move through the steps and generate new knowledge, we may have to revisit other steps and tailor either how we define the symptom or what biomarkers we look at, and then go back and continually go through the model. Up to this point, my program of research has predominantly focused on phenotypic characterization and biomarker discovery. I have several studies that are currently going in the clinical setting. For phenotypic characterization, we have a study that is ongoing in the Cancer Center where we're looking at the best ways that we measure cancer-related fatigue and how do we best assess it in our patients. Because until we can fully assess it, it's difficult to move through the next steps. I also have two studies that are looking at different aspects of biomarker discovery. As I mentioned before, I have a study that is looking at men with prostate cancer who are receiving radiation, and we are looking at two different biomarkers to determine if we can find something in the body that might be causing fatigue in this population. If we can define or identify a certain marker to target, then maybe we can develop an intervention such as a drug or look at a non-pharmaceutical intervention that might be able to target that specific marker that we identify to improve fatigue in this population. We are also hoping that by the identification of a biologic marker, we might be able to identify those who might be at risk for fatigue. And by identifying those at risk, we can provide early interventions such as education or start them on an exercise regimen that might help prevent the occurrence of fatigue in this population. So biomarkers can be used for a variety of purposes in nursing science. My other study, which is fairly new, will be using a mouse model to look at fatigue in prostate cancer and radiation. And I'm using this mouse model to look more in depth at things that aren't quite possible in a human. When looking at different biomarkers, it'd be great to look at brains or muscles or blood, but unfortunately with people, those are not always available sources of biologic data. With a mouse study, we can look more in depth at these tissues and hopefully use the findings from this study to guide future directions in our humans. Ultimately, the end goal of both studies is to identify a biologic marker that we can target to intervene to prevent or manage this symptom in a better way than we currently have right now. I'm going to conclude my talk with some advice or tidbits of information that you might find helpful as you move forward through your own nursing journeys. First and foremost, be open to new experiences. There are so many diverse and varied opportunities and directions that you can go in with nursing. And some might not even be ones that you've thought of before, like nursing research was for me as I was an undergraduate student. So I encourage you all to be open to new experiences, new paths that nursing may take you, because one of those paths could be your passion. Also, aligning with openness to new experiences is to be flexible. There are many different directions, paths, opportunities that might present themselves to you, and when possible, be flexible, be open to those experiences. Find your passion. Nursing is such a diverse, rewarding opportunity that there are endless possibilities for what could be your passion. But whatever it is, find that passion, own that passion, because nursing can be a difficult profession, and having that rewarding, having that opportunity to really make a difference in people's lives, that can be what pushes you to continue through this. For me, the opportunity to ask a clinical question such as, why is someone experiencing this symptom? Then to have the tools to answer that question and the opportunity to impact practice and change people's lives and improve the care that we deliver, that excites me and encourages me and keeps me going and gives me the energy to do what I'm doing. So find your passion that will drive you and motivate you when times might get tough. And they will get tough in nursing, but having that passion and having that excitement, that will continue to push us. Importantly, find good mentors. Mentorship shaped much of what I went through in nursing. So if you're having questions about what path might be right for you or what opportunities you should pursue, find that person, whether it's an instructor, whether it's a nurse that you encounter through your clinical rotations. Find someone that you can talk to about opportunities or experiences or challenges you might be facing. Good mentorship can really open your eyes to new opportunities that you have not considered. And last but definitely not least, have fun. Nursing is such a varied, diverse profession that there are many opportunities to have fun and enjoy what we're doing. And that is one of the most key things that I can leave off, is have fun with this journey. Embrace it, enjoy it, have fun. With that, I hope that you all consider a career in nursing research as an opportunity. Nursing research has allowed me many possibilities, has taken me to many different places that I never thought I would be, and I absolutely love it. And I hope that you all will consider nursing research as you move through your nursing journeys. Thank you for your time and for letting me share my story, and I wish you all the best of luck in your futures as you discover what you want to do with nursing.